Welcome to the Healthcare Nation podcast. I'm your host, Rick Gannotta, and we're committed to bringing you thought leaders in the field to discuss what's new and noteworthy in the health sector. This is the Healthcare Nation podcast. Welcome to the Healthcare Nation podcast. Your host here, Rick Gannotta, with our producer, Joe Woolworth. Joe, how are you doing, buddy?
I'm doing great. I'm in air
cool?
conditioning, so yeah.
Well, I'll tell you, I am as well. I think we're both. Well, I'm traveling, and I will tell you the melt factor outside is pretty darn high.
Yeah.
Pretty darn high. And
It
listen,
sure is.
if we don't talk about issues like climate change or anything like that, I will tell you, whether you believe in it or not, I will tell you the climate has changed outside for me. It's about 90 degrees.
Yeah, I would agree. You know, we've been getting feedback too on the show, particularly about people seem to love it when we talk about venture capitalism and investing. And we have a guest on that is one of the best, it seems like, in this regard.
Yeah, listen, we've got the Venture Valkyrie on, Lisa Suennen. So for those, let me just do a quick intro. So Lisa is an entrepreneur. She's an operations leader. You said it, venture capital investor, board director, industry advisor, been out there for many, many years. She's the CEO of Venture Valkyrie, which is a consulting firm. She's also faculty at UC Berkeley, the Haas School of Business. I've known Lisa for a while. She's an advisor to Manat in their venture capital fund and several others, Longitude Capital, Nina Capital. So she's got her finger on the pulse, Joe, of just what you're talking about in the venture world. But her perspective is also informed by some really cool things. She is a former fellow of the Aspen Institute. In fact, she was in the inaugural class of that. She co-founded C-Sweetener, which is a group that really looks at promoting women in the health sector and C-suite jobs, and that's just been fantastic. She's written a book, and one of the other pretty cool things is she works with NASA in their innovation world, and making sure that from a long distance travel, space astronauts, that folks are thinking about the sciences and how they that could be translated into, benefits for folks here on Earth. So we love that. So she is fantastic. So I think for the audience, she's got some great insights, and let's have her on. What do you say, Joe?
Yeah, some real jewels. And if you're wondering, like, Valkyrie, what's that come from? That's in Norse mythology. She's the one who decides who lives and dies on the battlefield, which is a great name for a venture capitalist.
Lisa Suennen, the Venture Valkyrie. Lisa, it's been a while since I saw you in person, although we've spoken on the phone.
Yes.
Great to have you on the podcast.
Thank you. So good to see you.
I've got so many questions for you. One thing Joe and I were talking about is just the fact that the response, the feedback we've gotten from a lot of our listeners is that we're taking a turn, really going much more into tech, innovation, disruption. And it always comes down to investments, investors, and what's happening in the market. And there's no one better to have on than Lisa, the Venture Valkyrie. So let me just jump in, Lisa. I mean, there's so much that I want to talk to you about. I think your intro kind of spelled out your background, but let me just jump in on, when you look back on your career, it's been impressive. Obviously, healthcare, tech coming together. What got you started? What drew you to that space in particular?
Well, what drew me to, let's just say, tech, although it wasn't really intentional, was some really cool formative internships in college, especially one at Regis McKenna. That Regis himself was one of the forefathers of Silicon Valley, helped start Apple and Intel and many other companies. And I worked at his professional services firm, and then I stayed in tech, general tech, for, maybe 5 years before I realized I was kind of bored, to be honest. And in speaking to some folks, including my dad, who'd been a healthcare entrepreneur, he suggested healthcare because it had the potential to do something good while making money while doing good, kind of thing. So I ended up joining a healthcare startup pretty early on in my career that was extremely formative for me, and saw that all the way from its earliest stage to its ultimate exit, and kind of stuck with it ever since,
Yeah, being good and doing good. I've always loved that. And from that kind of a start and that kind of an introduction with the folks that you were hanging with and part of your professional start to your career. You've seen a lot. I wanted to say this to the end, but let me just jump right in. What do you think about the current state of healthcare technology, and really where do you see it heading now? I always go 5 to 10 years. I think that's way too far. Let's just say 3 to 5 years.
Hmm. Well, I think healthcare is unfortunately, sicker than it's ever been in some ways. Just the complexities of the systems, how difficult it is for people to get good care and affordable care and equitable care and all of the things, is becoming more and more difficult, I think. And I think between the complexities and the consolidations and the economic world that we live in at the moment, I also think it's very hard for innovation to flourish. So it's a tough time, I think. I think technology, to just focus on that specifically, is a tool in the toolkit to make things better if the incentives are more aligned. I think when the incentives are misaligned, technology has a hard time landing. And I don't believe personally that technology in the absence of services is that effective in most cases. So I think the trick is to optimize services in a more thoughtful way for people, a more personalized way. I mean, with data the way it is now, we can be much more personalized and expand the definition of personalized medicine far beyond the drug world. And so I'm hopeful that's where we're headed.
Yeah, and let me follow up with that. And I think the sources of innovation, I would look historically at academic institutions, even government institutions. I would say, over the last 3 to 5 years, really looked more to the private sector as the source of that innovative mindset and what's happening. And why don't you share your perspective with me and the listeners on your thoughts on how private equity and venture capital, the role they play in driving innovation in healthcare and med tech specifically?
Yeah, it's really interesting, Rick. I mean, I think a lot of innovative science and technology does come out of academics and government, but it's rare that it makes the leap over to the commercial side because there's the sort of skill set required to commercialize things from research to reality is often absent in those worlds. And so there've been a lot of collaborations to help, people cross that chasm, if you will, some of which work and some of which don't. People who come, to the world with entrepreneurial and innovative ideas that can make it, tend to be more in the private sector. That is true. And because in healthcare it costs so much to get a lot of these companies really to scale, venture capital and private equity are essential tools for them. It's hard to bootstrap a healthcare company. It is done, and it's better when done that way, frankly. But the creation of most of the companies you'd be able to reel off by name these days in healthcare that are considered leaders in innovative things, whatever they may be, outside of the hospital systems, really come from the, venture-backed world and then ultimately sustained in many cases by the PE-backed world, although that is a very different kind of financing, I think, than venture.
Yeah, and one piece to that I've thought is that although there's so many good ideas out there, particularly in the
Hmm.
startup healthcare space, but
Yeah.
what there is a lack of real world understanding of how healthcare and healthcare economics and the
God, yeah.
delivery side of the sector works. And I
Yeah.
know with what you do at Venture Valkyrie, not unlike what I do in my side hustle, for lack of a better term, is working with those folks. Tell me about the key messages and insights that you bring to some of your clients who are really trying to
Yeah.
take that great idea and commercialize it in the delivery space.
It's interesting. I spent last week, I think it was last week. Yeah. No, it was earlier this week. My God, time compression. It was earlier this week. I was
Running
at
away.
a very well-known, very well-funded, extremely high quality, academically generated healthcare innovation accelerator type entity, right? But very much embedded in an academic setting. And they asked me to come in and help them look at their 5 or 6 primary projects because they're very well suited for the academic medical center worlds they sort of live in, but they don't know how to bring them to the marketplace. And I think the things that was so obvious to me, and that is often not obvious to folks in the innovation world, whether it's from the scientific academic side or from even the private sector side, is how money flows in the system, understanding that, how incentives are misaligned or aligned in the system, what it takes to get people motivated and incentivized to bring on new ideas, and how complicated the cultural issues are, both the financial and cultural issues are, and how essential it is, not just nice, but, like you got to understand how to work in that milieu in order to bring your program to life. I was one in particular I thought was a brilliant idea, but constructed in a way where my first question was, well, that's all well and good, but who pays for that, and why? And
Yeah.
they really didn't answer that question. And I think I'm often the person, nobody loves it, but I'm often the person trying to inject the reality of the system into the discussion, even if it's a device or a drug or whatever it may be, service innovation, because I think oftentimes people get enamored of their technology or idea, and they have this sort of if we build it they will come mentality, and guess what, if you build it they won't come unless you really serve
And,
their interests.
and they won't pay for it either. That's the other.
They'll
That's the other
come, they
piece.
won't pay for it, they won't take your phone call, they won't answer your email, they want nothing.
So let me go down a little bit of a rabbit hole with that. I have been very, bullish on the consumer side of things, what's happening and evolving. I think it's generational and with respect to many aspects and positive features of it. How does that fit into that equation? It's almost like short circuiting the healthcare economic, structure to go into this consumer structure, but still deliver healthcare services. Is that something you see sticking, growing? Top of mind for me are companies like Roman, Hims, what's happening now, I think, with One Medical and Amazon, where that could lead. Give us your insights on that.
So I think that consumers, patients, humans mostly don't give a damn and don't want to be associated with the healthcare system in any way. They don't want to be thought of as sick or think of themselves as ill. They don't want to think about it until they're in desperate straits and need to think about it. And the only exception to that, I would say, comes in maybe 3 areas. One is pediatrics. People will do almost anything for their kids, even if it costs them a lot of money out of pocket. Number 2 is cancer. People try anything to survive when they have cancer, and including pay for things out of pocket that are not in the medical system. And number 3, beauty and sexual aids, which are the realms of, Hims and Roman and many of these other companies, because beauty and some of those other things don't get covered by insurance typically. Outside of that, I think consumers aren't paying for anything and won't pay for anything, and it's getting worse, not better. And I think companies that rely on consumer pay are usually doomed, frankly, unless they're in one of the things I just said, because even One Medical doesn't make any material money from consumers. They make it from insurance and from, deals they do with provider organizations. And they found that out the hard way, trying to create a business around just the membership fees. It's immaterial compared to the insurance payments they gather. So I think while I hear you on the consumer front, and I do think consumers in some segments of society are more self-aware and more engaged than previously, I would say it's a small minority, and it's not a way to target a business, except in the areas I mentioned.
Great points. So when you're advising, the investment firms, that you're obviously putting your key insights to, what kind of influence does that mindset, that thought process have when you're telling them about certain considerations for a given opportunity? Is it
Yeah.
weigh in heavily? Are they surprised? I'm just trying to gauge
It
whether
varies.
it's something that's an aha moment.
They're often surprised, but they often will listen, and sometimes they won't, and the nature of consulting and advisory work is, they want your opinion, but they don't always want to hear your opinion and listen to your opinion. And it's probably the main reason why I actually don't intend to stay in this role. I'm actually looking for a CEO role right now. I headed back to the operating side because I think, it's hard to influence companies either as an investor or as a consultant to really make big change in their objective because they've, sort of set their strategy and they're willing to do some incremental stuff sometimes, but it's really hard to get them to make fundamental business model changes unless they've already experienced misery and doom, I spent actually a lot of time counseling companies coming from overseas, and so many of them just do not understand the fundamental differences in our healthcare system from a single payer, state-sponsored healthcare system type model. And, they are blown away, I think, sometimes by how illogical our system is designed to be. Maybe not designed to be, but turns out to be. And how different that is from, their models in Europe and Australia and places, and how that makes the leap overseas almost impossible in some cases. I think digital health has suffered from this in the US quite a bit, is that it really fundamentally is mostly designed, the products and services and the clinical side of digital health, for value-based, single payer type worlds, which we are not. And while we talk about it a lot, if I had a dime for every time somebody said value-based to me, I'd, be rich and not on this podcast because I'd be in Hawaii somewhere. But I don't know. It's a complicated endeavor to try to get companies to and change their stripes,
Yeah, I think two big points in that. One, clearly, I'm in total agreement with you on the overseas non-US healthcare perspective. It is just apples and oranges. It's beyond. There's just no comparison. I mean,
it's
here
like
in the
apples and
US,
zebras. We're not even in the same
right,
sort of
right.
category.
Phylum. Yeah. I mean, I think that's why we've got academics and masters in health administration and our policy and our economics. They're all within this structure of healthcare, which I think other, fairly highly evolved systems with respect to healthcare delivery, they don't have any idea of some of the challenge it is, not only from a financial perspective, but just the regulatory hurdles and the delivery side here in the US. Which brings me to another point. When I look at investment right now, it seems to me that, certainly on the health side, the tech folks who are trying to keep the faith for the future in what I think is kind of, shaky times, they're really looking at a handful of things. Maybe it's telehealth, AI, wearable techs. What do you think they're betting on for 2024 and beyond? Is it just more of the same, building on that, or is it the tactical and practical? Is it models of care?
You mean for investors?
Yeah.
I think the biggest sort of hot trend, if you will, is moving care to the home. Everything from basic, to diagnostics, to care delivery, to even ICU at home. I mean, that is a massive trend. I do think AI is, well, certainly the buzzword of the year. Maybe the only words said more than value-based in my day-to-day life, but I think there's still a lot of hype and more than there is action in most of the segments of AI, and the practical use of it is not yet there. That will be there, and it is coming, no doubt about it. But the business models and the material applications are not, well understood, and there's real distrust, I think, in a lot of the data and the outputs, as there should be in a world where data is not, it's not easily integrated, it is not often correct, and it is filled with bias. That's a problem for the outcome of what it says. So while there's some really interesting and promising uses, and I think there's a lot of investment going there, I think there's a lot of reckoning to be had as well before the Gartner hype cycle starts back up,
Right. And I think about when I get to the investment side, the silver lining, higher returns from lower valuations, the long game to a certain extent. Is there a shift now towards more early stage investments because of the kind of cycle of where we're at with AI and ML? versus the later stage?
No, actually, what there is a bifurcated world right now. If you look at the numbers around investment in healthcare, venture especially, the numbers are down by, I don't know, 50, 60% over prior couple of years. The cycle is not done. I mean, we are nowhere near the bottom, I don't think. Personally, I think we got at least another year of pain here. So what's happened to investors is they're investing in basically three things. One in mostly is the companies they already invested in to try to save them during this difficult time. And actually in that regard, they're starting to get to what I like to call the Sophie's Choice part of the program, which is picking which ones of their investments they're going to save, because a lot of it's too late or can't be done. Number two, they're investing heavily in late stage assets that are now available to them at earlier stage prices. So basically investing in growth with venture money, because you can get a late stage company that's valuation is dropping because of the market, and, much more de-risked, much earlier exit timelines. So great, bet if you do it well. And then the third thing they are investing in is the very, very early stage, seed stage, pre-A, if you will, because it's inexpensive comparatively. And the problem with all of that is when you get to needing the A round or the B round, when you're one of those young companies, you better hope the market's coming back, because that is, the so-called valley of death always, but it's a particularly deep valley right now.
Yeah, no, that was a great lesson, I think, with the bifurcation in that of what's happening in the market right now. Particularly, I don't know if I could characterize it as such, but the slippage of these later stage from a valuation perspective into something that's more affordable, probably not the right term to use, for an investor. And,
Slippage is a nice
when
way
you
to say it.
de-risk
I think it's more like avalanche.
yeah, avalanche on that. But with everything that's hitting, it probably is.
Yeah.
That's a good point. Let me shift a little
Gravity
bit
is
and
a bitch.
get a little, inside your head. Yeah. Your focus on, coloring outside the lines, challenging old ways of thinking. I think some of what you believe in philosophically just came through in what we're just talking about. Share some of this approach in action with me and with the audience.
It looks mostly like just being brutally honest, right? And not engaging in conventional wisdom, not engaging in buzzwordy, orientation stuff, but in being super granularly practical about opportunities. And that shouldn't be coloring outside the lines. That should be the lines. But unfortunately, I think it is, and calling it out as it really is something I guess I'm kind of known for, and people either love it or hate it, I also feel like we spend way too much time thinking about how things have always been done and incrementing from the side of that. And while it's much harder to blow something up and start over, and this is particularly true, I think, in running businesses, not so much in creating new startups, but in businesses where they kind of always done something a certain way and they're wanting to change it from, like red to orange. I'm like, why not green? I think getting people to think outside their usual parameters, of what their conventional wisdom is so important, because, I seem to be the one that was always in the room going like, well, why do we have to do it that way? And I'm amazed how often that not just surprises people to think something that way, but also that I'm not surprised how resonant it is, because nobody wants to be locked in their box, right, if they can get out. But it's not always easy for people to do.
Yeah. So tell me, how does that mindset, and I love that, by the way, it's not green, it's not red, maybe it's yellow. I love that. When you think about what you're doing, you've been working with NASA, the Translational Research Institute, for a while. Government entity. How do they respond when you get into a bureaucratic kind of an organization? That's what comes to mind when I think about that organization. How do you make them think innovatively, out of the box, outside the lines, particularly when you're in a high reliability process like
Right.
they're working on day in and day out?
Well, it's interesting. So the institute that I'm involved with, which is the Translational Research Institute for Space Health, is an institute funded by NASA that is exactly designed for what I do, which is figure out completely out of left field different approaches to supporting the health of the astronauts on the mission to Mars and deep space. Because everything we do in conventional medicine ain't going to work. So you imagine, if you will, you're on a 3-year journey in a small capsule with no place to stop. There's no One Medical on the way to Mars. And now you're the flight surgeon who's on the trip, the one flight surgeon who's likely to be on the trip. And you've got an emergency situation where that person is incapacitated for whatever reason. Let's call it a kidney stone, What are the odds? They're going to be middle-aged men mostly. That odds are high, right? So,
Yeah.
how do you
And
prepare?
zero gravity's working against you. Yeah.
Right. You can't put a giant lithotripsy machine on the space capsule. You have to think about, how do you miniaturize? How do you do this differently? What non-surgeon might be able to perform a procedure? How do you get them ready to do that? So it's a huge exercise in not in the box thinking. And it's so interesting, because if you look at the issues that affect people in space, they're almost exactly like the issues that affect people as they age. So it's cognitive issues, it's eyesight issues, pressure on the ocular lens, it's bones deteriorating, because of the anti-gravity thing. It's access to good food that's not processed. It's access to pharmaceuticals in real time because they expire, while you're in space. And like, what do you do? So how do you make real-time medicines? All sorts of things. And very little space to work in, because it's a small, thingy. So how do you just completely think differently about science and medicine and marry both government and entrepreneurial thinking to this use? And that institute is specifically about that. So it's not a bureaucratic enterprise at all. They have a lot of authority to do kind of weird stuff. And the people that run that, I mean, I chair the scientific advisory board, which is an absolute blast. And the people you're dealing with are just amazing, smart people, both the people that work at the institute and the companies and entrepreneurs and scientists and researchers they interact with.
Anything that you've seen that you think are insights that we should be applying in the healthcare delivery system, or that a young entrepreneur might say, hey, this should be applied into, care at home, not unlike care
100%.
in space?
That is actually kind of the counterpart mission there, which is, if we can do something that will benefit and address these issues in space, they should work in the real, Earth world too. And so that's why there's so much collaboration with entrepreneurs. But yeah, sure, miniaturizing things, making it minimally invasive, making it possible to do procedures with surgeons, for instance, or in the home, creating pharmaceuticals in real time, creating, healthy foods in a weird environment in real time, and keeping the environment of the capsule healthy so it doesn't fill with chemicals or, gases or things that are harmful to the health of the astronauts. All of those things have to happen. And every one of those things is applicable on Earth as well.
Yeah. Switching to things that are applicable on Earth, something that's happening on Earth, Sea Sweetener, a fantastic initiative. Tell us a little bit about that, your role in founding that, and what's happening with it, with what's new and exciting, I think, with some partnerships with it.
Yeah, well, actually, it's a company I founded some years ago, 2015 or 16, something like that, I think. And it was and is a matching, dating software, if you will. But instead of dating, it's for matching women rising in healthcare with executives and experts in healthcare who are interested in giving back and mentoring women on the rise. And I founded it with a colleague and started as a result of my fellowship at the Aspen Institute and the Health Innovation Fellowship I had there, which was super fun. It grew. There were hundreds and hundreds of people involved as mentors and as participants. And I was lucky enough to be able to sell it to the HLTH Foundation a few years back, and they've continued it on and grown it quite a bit. So my ownership of it is no longer a thing, but my participation in it as a mentor is. It's really fun. It's like you meet these amazing people who want to meet you and learn from you, and where you learn back. I mean, it's really a lovely experience to feel like you're helping someone, but also to feel like you're meeting people that are going to be important in your life along the way. So,
Yeah. And changing lives and changing things like care delivery. And again, I would say challenging the status quo, which is fantastic.
yeah.
Getting that diversity of ideas couldn't happen without it. Super. Let's tectonics. I think when we look at the book, very intriguing. I know it's been out a few years. Tell us a little bit about the feedback you got. Well, first, give us the quick pitch on the book itself, and
Sure.
why is it still relevant? Which I think it is.
Thank you. Well, Tectonics was a book I wrote with David Shaywitz, now a entrepreneur in residence at Takeda. Brilliant guy. He and I had started a podcast called Tectonics, which you could still find out there on iTunes or Apple or whatever they call it now, about the intersection of health and technology and the sort of new thinkers in that space. We did that for 6 years, and we were sort of, actually we were also writing, both of us, blogs and things about the topics, and we decided to collaborate and pull this book together, thinking about how entrepreneurs and others are coming to the space to make a difference and the opportunities and challenges of doing so. So while the book is a little out of date, it's in the specific. In the general, I think it's very much still topical because it speaks to the issues around the complexities of this and also around the joy of making a difference in this space when you do, and how, great thinkers in health tech and health services and pharma and biotech and medtech are trying to do that. A lot of fun. It was a lot of fun to write together. I actually just wrote a chapter in another book called Artists Remaking Medicine, which is authored primarily by Emily Peters, but who's awesome. I'm sure you can find it on Amazon. And the book is about the intersection of art and healthcare, which is a weird combo when you first hear about it. But if you read the book, it's kind of amazing how many interesting things are there to think and learn about, and to sort of look at the world differently through art and its intersection with healthcare, which is quite profound, actually.
Yeah, and I have been a big believer that the entrepreneur as artist is the themes that carry across both those personas is very, very powerful. And
I agree.
if you think about drivers, and when you throw healthcare in that, I mean, it's just a variable that has got particularly now for young people, really could influence them. And I think the book and as you said, the chapter that you just wrote, must read for anyone that's out there thinking about what their next step is as an entrepreneur, or if they have a startup in healthcare. And Lisa, with that, let me ask you this, just to wrap things up as our final question. You've worked in tech and healthcare, you've been on boards, you advise on the venture side, as well as really cool things like what you're doing with NASA. What's your advice for the young folks that are up and comers, who are entrepreneurs, thinking to make a difference with something that to them is game changing? What would you say to them?
First of all, I'd say go for it, because we need change and we need innovation in healthcare because it needs help to be better. But I'd also say if you aren't somebody who understands healthcare, how it actually works today, really at every granular level, like surround yourself with other people who are, because it's very tough to blow it up and disrupt it and all those cute words. You really have to figure out how to integrate into a kind of crazy system and change from within. That's my biggest piece of advice, I guess. And also just, it takes a really long time for these companies and ideas to be adopted and to scale. So gird yourself for the long haul. It's a 10 to 15 year experience. But don't give up. Like, just, lock in, because it's hard and it's long, but it's very rewarding when it happens.
Don't give up. That's the key. And I'm glad you haven't given up. And with that, we want to have you back on the podcast, see what you're up to.
Thanks.
Opinions expressed by the host and guests are for informational purposes only and not associated with any companies or academic institutions. Please follow us wherever you listen to your podcasts, as well as our YouTube channel, Healthcare Nation Podcast. And if you have any questions or want to contact us, please reach out to healthcarenationpodcast.com.